So welcome. I'm Darius Moshfeghi at the Byers Eye Institute. I'm the Chief of Retina there at Stanford University. And I'm joined today by Derek Van Amerongen, who is from Humana, Vice President and Medical Officer in Ohio. And our topic today is zooming in on the education and empowerment of patients in the treatment selection and prior authorization processes. And it sounds more exciting than it actually is. So the goal of today's learning objective is to describe step therapy policies and implications for patients and to educate and empower patients to become their own advocates in their treatment choice and navigate through the prior authorization process. First of all, our patients really need to understand their rights. And step therapy is something that organizations, retina specialists really get their arms up in the air and they're like, oh, those evil payer companies. And it's really not something that's been targeted at retina specialists. It's something that has actually come about in other fields. And there's a socioeconomic rationale behind it. There's actually medical evidence behind it. And I'm here to kind of, say, hey, where is the rationale from the payer side, and can you kind of walk us through it, Derek?
Sure, Darius, and I think this is really a very timely and important topic. I don't think, as you said, that this is necessarily a critical issue in ophthalmology or in retinal medicine, but in so many other areas, the issue of step therapy is really important. We're finding out more and more, for example, about the role of physical therapy long-term in terms of managing knee issues rather than immediately doing knee surgeries. The studies are showing that almost as many patients will benefit from low-impact physical therapy as invasive surgery. And of course, surgery has multiple risks. It has a cost. It has potential for complications. And of course, once you do surgery, the tissue is never going to be the same. And you could apply that to some of the discussion around pain management, which has led us to the opioid epidemic. Point I'm getting at is step therapy, the idea that you start with the least invasive and least complex treatment and then work your way up. I think that's a valid concept in medicine that's been around for quite frankly, forever. And so understanding how the standard of care outlines that progression of treatments is really what the payers are all about. Members' benefits, as we're pointing out in this slide, are outlined in their certificates. And really the heart of that is that payers are committed to providing coverage for standard of care treatments. We are not interested in supporting experimental or investigational treatments. There's an entirely different process for that. And certainly payers do provide coverage for the routine care associated with NCI and NIH trials. But what payers are all about is making sure that the treatments that are being funded and supported really comply with the evidence in the literature in terms of effectiveness and safety and outcome. Now, we all need to be prepared to advocate for our medical needs, and I would say that every individual needs to be prepared to understand what he or she needs. Patient preferences are absolutely key nowadays. And we all want to make sure that whatever care is being proposed is in line with patients' preferences and goals in terms of maximizing quality of life, in terms of maximizing independence, the ability to function and accomplish activities of daily living, and so on. At the same time, we also need to understand that coverage is limited, that not everything under the sun is or should be covered. Because many of those things don't necessarily relate, as I said, to the direct medical standard of care for that particular area. Now, as we think about how do we educate patients on step therapy, it's really, again, helping individuals understand, first and foremost, their condition. How do we make sure that an individual is able to grasp, regardless of his or her level of health literacy, what we're talking about? I can't tell you how often I have had our nurse case managers or even clinicians who I am familiar with in the community have told me that they've talked to someone who has diabetes And after many years, the individual still doesn't really totally understand the role of the pancreas and what this has to do with diet and sugar and so on. And I think that's unfortunately a scenario that's repeated all too often, that even individuals with chronic conditions that they've been dealing with for years still have a very imperfect understanding of their condition, what the expectation of outcome is, what the treatment is, and very importantly, what their role as a patient working with their healthcare professional team is. So understanding what the various levels of intervention are, understanding what the realistic outcomes are, and understanding what is considered to be the appropriate next step is really critical in terms of helping individuals understand their condition, but also very importantly, being able to work with their healthcare professional team in a collaborative way.
Excellent summary, Derek. So, the reticence historically for step therapy on the retina side has been, hey, my patients are going to lose vision. Once they lose vision, they're not going to get it back. I think that message has by and large been heard by the payer groups, and they are a lot more flexible in their approaches these days. This is a much longer conversation. It's not just restricted to ophthalmology or retina. This is a national conversation that has to occur. What I would encourage our audience members today who are on the retina side of the equation is, if you feel that you're being unfairly, put in this box and have a one-size-fit-all regimen, there are resources out there. Contact your national organizations and find out what they recommend. And again, going back to this concept of, is it just your practice that this is being targeted, or is it something that's part of a broader trend? And it's useful to reach out to your colleagues. As Derek noted, we have patient adherence problems in many diseases, specifically chronic diseases, diabetes, glaucoma, and in macular degeneration also. And even if we initiate therapy in macular degeneration and we save vision, or we actually regain vision, our goal is actually to maintain those gains. We don't want to kind of blow all our winnings and have some patient go off for 6 months and not be seen. And so it's very important on the physician side that we sit there and have a lot of education. And it's not just with the patient, it's with the person who's driving them, or it's with their family members. What are the resources, if any, that the payer organizations put into treatment adherence, Derek?
Well, we understand everything that you just said, Darius, in terms of the critical role of adherence and compliance. No one is happy if a patient comes in, has an injection, and then doesn't show up for 6 or 9 months, and then as a result of that gets no benefit from that initial treatment, in fact, even deteriorates. I mean, that is a lose-lose situation all around. So we very much want to promote that, but I think that the keys to that are understanding really what drive adherence and compliance. And anyone who studied the science of compliance knows that it's extremely complex. Probably one of the least important attributes is the actual drug itself, and I would say even the route of administration. At the top of the list, I would put understanding the disease. What is it I have? What are the potential complications? Why do I need to treat this? What are the various treatments associated with it? Also helping the patient understand, what are the realistic outcomes? Is this going to give me the eyesight I had when I was 20 years old, or do I need to recognize that there are going to be limitations going forward, but ones that will still allow me to be functional and drive and accomplish the things I want to accomplish? Patients very often are concerned about safety issues. We hear so much in the press nowadays, and I think appropriately so, about the potential safety drawbacks of many of the treatments that are available, and we need to reassure patients, at the same time be transparent with them and educate them on the potential negative aspects of any treatment, the things that they need to be aware of, and report back to the physician and so on. Engaging the patient, engaging the family as well is critically important for all of these topics I've mentioned. And once you get to that point, especially when you develop that level of trust, then I think we see a great opportunity to maximize adherence. And of course, when you maximize adherence, the reason we want to maximize adherence is to maximize outcomes.
Excellent point. Now, this next slide is called enhancing physician-patient communication, but it really should be enhancing care team-patient communication. Got to keep in mind that about half the time that a patient is in my office, they're not with me. They're with my technician or the nurse. And those people actually have back channel ways of communication. They talk with the patient when they're not in the clinic, either through returning of voice messages or what have you. And that's another very important way to get home this message, either through handing out of brochures or just reassuring them that they're not alone. There's a lot of patients who are doing this, and yes, it's kind of a pain, but it's worth it in the long haul because you're able to maintain your independence. So again, contact your local organizations, your national organizations for patient information handouts, loop in the family, use your own team and resources. And so as we conclude here, Derek, and I just have to say it's been really fun working with you on this, the take-home strategy here, number one, is do everything in your power to educate the patients, yourself, and your payer group. And then the second thing is if you're working up against kind of, you know, something that you're not familiar with, such as step therapy, reach out, educate yourself, and figure out what you can do and embrace the challenge and see what's out there. And for those of you who have been watching us, thank you for your time and efforts.
Thank you.